How trauma fuels addiction and changes the brain. People who witness, survive, and recover from trauma often turn to alcohol and other drugs for comfort. But it's not just because they're trying to self-medicate. Trauma causes real changes in the brain that may influence addictive behavior. Fear circuitry. Fight, flight, and freeze. In front of our brains is an area called the prefrontal cortex, and this area of the brain helps us make decisions, think rationally, remember important stuff, and more. However, when we're extremely frightened, like during a traumatic event, our prefrontal cortex doesn't function as well. If you've ever been through a traumatic event, you know how hard it is to think clearly. Even something as basic as asking for help can be difficult. Some researchers call this fear circuitry. Fear circuitry is so powerful, it can overrule our natural fight or flight response. In fact, one of the most common reactions to trauma is freezing, where a person becomes immobile instead of trying to run away or stand and fight. It's a so-called deer in the headlights reaction, and it's hardwired into our brain. How trauma changes the brain. Traumatic events alter the way three areas in the brain function. First, causes the hippocampus, which helps us manage our short-term memory, to shrink. And this is why many people who have post-traumatic stress disorder, or PTSD, have flashbacks, is because they have trouble distinguishing between past and present experiences. Secondly, trauma causes the brain's amygdala to grow. The amygdala acts as an alert center to the brain, and when it grows in size, we become far more sensitive to stress and have trouble controlling our emotions. Remember the prefrontal cortex? Trauma causes it to shrink, which makes emotional control, like regulating fear responses, much more difficult. Combined, these physical changes in the brain amplify emotions like fear and also make them harder to keep under control. How trauma fuels addiction. Many people try to manage the symptoms of trauma through substance abuse. Alcohol and other drugs help numb emotional pain and provide an escape from flashbacks, intrusive thoughts, and other symptoms of trauma. Substance abuse as a way to self-medicate for trauma is especially harmful. Most people experience new traumatic events while addicted, making their conditions even worse. However, both addiction and trauma are treatable. The Edge Treatment Center. Trauma-informed, effective addiction treatment. The Edge is guided by a trauma-informed philosophy. Everything from our programs to the way our staff interacts with our clients is done with acknowledgement of the unique symptoms survivors of trauma face. With the right help, you'll be able to treat your symptoms of trauma and addiction and build a successful new life where the past stays in the past. Reach out to the Edge Treatment Center today at 844-590-0403 and we'll get a conversation about addiction and mental health going.